on this end. Perfect.
All right. Hello, everybody. Let me close out some tabs so I am not distracted here. There we go. All right, we are live with our special guest today. She will be introducing herself soon. We are talking about pelvic floor. We know that we have about 95% women in our community, and we also know how important this subject is and how common it can actually be, but we don't really realize it because no one talks about it that often, right? So we're going to talk all about the pelvic floor, how it manifests basically, and what we can do about it. And Nicole is full of knowledge, research, statistics, and passion about it. So we can't wait to dive in. Before we do, though, we're going to do some introductions if you're new to our community, and then get started. So I am Casey Kephart. I'm a functional medicine nutritionist. I am the founder of the Feel Good Formula. I work with women with all different types of autoimmune diseases to get back to the activities you love to do and get your life back and trash those symptoms. And I reside in St. Petersburg, Florida, where the sun always shines. Jessica?
You bet. And I'm Jessica Melnick. I am a registered holistic nutritionist, the founder of the Anti-Arthritis Method, and the host of the Happy Joints Arthritis Solutions Group. And I help both women and men with various forms of arthritis get back to living life the way that they want to, not the way that they have to. And I'm in Saskatchewan, Canada, where the sun shines quite a bit, but it is pretty overcast and gloomy today. But that's to be expected. We can have 3 different climates in one day here where I live.
Right.
So I'm going to pass it on to you, Nicole. Thank you so much for being here. And please tell us a little bit about yourself and what you do.
Hi, everyone. So I am an occupational therapist by background who specializes in women's health and pelvic floor therapy. I live in New York currently in Rockland County.
Wonderful. Well, welcome. And we're so happy to be talking with you today. Like Casey said, this is such an important issue. So many women have these issues and not even realize it, or they've been going to multiple doctors and have been told that nothing is wrong, and they're just not really quite sure where to turn. So today we're going to talk about what pelvic floor issues actually look like, what to look for, and what you can actually do about it. And Nicole, I know you're a wealth of knowledge on this topic and you are very passionate about what you do. So why don't we start off with, do you mind sharing your story actually of how you were affected by a pelvic floor issue and how you came to realize what was going on and how you actually treated yourself?
So my children are kind of bigger now. So I have a 13-year-old, I have a 16-year-old. My suspicion is that my pelvic floor injury probably started after the birth of my 13-year-old. I began actually experiencing sciatica, kind of low back pain. It would kind of get worse whenever I would exercise. And at that time, I was very big with going to the gym and doing squats, lifting weights. I didn't really stop anything. I just kind of kept going. So the symptoms actually started getting worse. Mm-hmm. So it began to feel like I had fire in the back part of my legs that would get worse the longer I was standing. I started getting urinary frequency, even frequent UTIs. I was having constipation. I was having pain with sex. Sometimes as actually the time went on, the pain with sex got so intense that I actually had pain hours after. What exactly was the pain? It was more like a burning sensation, almost like discomfort, but more along the lines of burning. Mm-hmm. I didn't know what to do. I was at work one day and the pain got so unbearable that I went to the hospital. I was actually admitted where they did a whole complete spinal MRI. Nothing was found. They had suspicions of MS, but nothing showed. I was then sent home and referred to a neurologist, which I saw We did a nerve conduction test, and that came back that everything was normal. I went to see a spinal orthopedic surgeon, and there was nothing to be done. There was no evidence of me needing surgery or even me having anything that would be eliciting this type of pain. I remember like feeling alone. I remember feeling depressed, scared, because if they didn't know what was wrong, how was I ever, like, was I supposed to live like this? Like, was this supposed to be life? And I went through severe depression because of it. And it was funny because as an OT, I was working in subacute, and we had gotten in a patient and they were having incontinence and bladder issues. So as an OT, we always work on toileting. So that was within our scope. So I went online and I was looking up stuff that maybe I can find, like courses to kind of help her. So I stumbled across one course. I went, I took the course. It was phenomenal. It kind of piqued my interest. So I started looking at more courses, and I started sitting in more courses, not realizing that I was actually finding my specialty, because at that point I never wanted to be a business owner. So I took all these courses, and I remember sitting in one where we were getting cleared for to do internal work. And that was when I realized what my pelvic floor injury was. And I remember, like, it was surreal, I swear, because it's like you would think that you're happy to know that there's something wrong, there's an answer, right? But at the same time, you're like, oh my God, there's something wrong with me. And you still feel bad. So I went home and, I started seeing a chiropractor, which helped me greatly because I couldn't do certain adjustments on myself. I was also seeing an acupuncturist to help me bypass the pain. And I was also treating myself with internal release techniques with tools that I was able to use. And now I don't have sex with pain anymore. I don't experience frequent urination. My constipation is improved. I haven't had any of those symptoms that I did, in the past. So I felt like, because of the hell that I went through, I didn't want another woman to have to deal with that. And if I knew how to fix it, I had to share it. So I tried my best to share it, in the subacutes and the assisted livings where I was currently working. It wasn't exactly going well. So I was kind of pushed into just owning your own business. And that's basically how I started with Pivotal Performance.
What an incredible journey. And I can even hear in your voice how passionate you are about it. One, because you don't have to experience this pain anymore, but two, most importantly, you can help so many other women feel better again and recover. And I think your story can relate to so many women who are listening to this video, because having an autoimmune disease, we go from doctor to doctor to doctor and not getting answers. And that feeling when we finally get the answer of what the heck is wrong with us, we're like, am I happy about this? Or am I sad that now I'm living with an autoimmune disease and I have to now figure out how the heck to do this journey? So very relatable there. So tell us a little bit now take us through the journey of working with a patient, basically. What is the demographic that calls you? Postnatal, prenatal, all of the things.
Honestly, I love working with all women. I really do. I can't say that there's one age group that I enjoy over the next.
So what age groups are you working with, though?
My patients range So they can be in their early 20s. They can be all the way up to like mid 80s. So it's definitely a range. I do have pregnant patients. I have patients that recently are postpartum, or they could even be postpartum up to like 10 years and discover that they have a pelvic floor issue, and that's why they're coming for help.
So I'm curious, Nicole, what are the most like common symptoms that and are sometimes maybe missed in terms of what pelvic floor issues look like?
Sure. So any kind of incontinence, meaning that if you are sneezing, coughing, and you're leaking urine, if you are jumping, or maybe you leak when you lift something or you're doing exercise, those are probably the most like outstanding. But the sneaky culprits are like sciatica pain, any kind of like groin, deep hip pain, vaginal or pubic bone pain. Constipation is a huge one. Any kind of pain with sex. So sex should not be uncomfortable, discomfort. It should be painless and enjoyable. There are a lot of myths surrounding that. So I think women are kind of taught through the years that like some level of discomfort is actually normal. And it's not. Even if it's right after having a baby, it shouldn't hurt. And if it does, there's something going on with the pelvic floor.
Good. So good to know, because I think a lot of that stuff you just wouldn't think. Like I never would have thought, oh well, sciatica, like you know, I know a lot of the people I work with in my community with arthritis, sciatica is an issue a lot of the time, you know, and that low back pain and the burning down the legs, all that awful stuff. And constipation, like I never would have thought about that. I know as a nutritionist, my first thought is, okay, well, what are you eating? You know, are you getting enough water? All those kind of things. Are you stressed out? And I know when we were talking earlier, you had mentioned that there's a lot of an emotional component to this. It's not just the physical symptoms, you know, and I thought it was so interesting how you said that sometimes it's like having anxiety can actually bring on a pelvic floor issue and vice versa. Did you want to talk a little bit about that and the emotional component?
Sure. So a lot of the times, like whenever someone is living with pain, it's going to stir up feelings of anxiety. It's going to stir up emotional, you know, you feel separated. You're the only one that's going through this. You can't talk to anybody about this. Your doctors may not even really pay attention to what you say. It's very isolating, and it could be very scary at times too. So there's a huge emotional component. I don't know, like there's definitely arguments that go around and say like conditions like vaginismus are started, you know, because of trauma. But then there's research that kind of supports that it started with muscle and then was aggravated by trauma. So can anxiety and those types of qualities add on to symptoms that you already have? Yes. And how would it add on? So a lot of times when we have anxiety, I know for me, I used to actually like clench things. So I was famous for like either squeezing my legs, right? Or squeezing my butt and holding my abs in. All three actually contribute to pelvic floor dysfunction.
Interesting. Wow.
Yeah, I think sometimes too with that physical response to anxiety, we don't even realize that we're doing that, right? And you're kind of giving yourself all this bodily distress and not realizing. And I'm kind of by nature a type A, fairly anxious, high-strung person by nature. So I've definitely experienced some of these things for sure. I can relate to that.
And I know I clench my jaw when I am stressed, and it's like, okay, Casey, just release a little bit of tension in your jaw. And so I can only imagine that we're all doing something in these anxious forms, and having a chronic health issue. I don't know how it's not possible to have anxiety with it, or some pressure building up with it. So for anybody listening right now, if you have any of those symptoms or little quirks that Nicole is talking about, it might be worth checking into a pelvic floor issue. So Nicole, talk about, if you could, what would be the process for somebody to find help, or what would be the questions to ask, even if they just have a general practitioner they're going to?
Sure. So there's actually a couple of websites that women can go on. So Pelvic Guru
Okay.
is one, and they can actually find a practitioner within their community if there is one available.
Mm-hmm.
Herman and Wallace is another place that they can actually go, or they can actually Google pelvic floor therapist near me.
Okay.
And usually they will have listings that will kind of show. There are some doctors, OBGYNs or primary care physicians, even some gastroenterologists that may be familiar with pelvic floor therapy and can guide them. But because it still is such a new and upcoming kind of therapy, not many doctors are even familiar with it. Sometimes, just because you don't get an answer doesn't mean that it's out there. It just means that the doctor may not be aware that this particular service exists.
Mm-hmm. Could you walk us through, if somebody was going to need or do your services, what does that look like? What is the process of actually getting help from a pelvic floor therapist?
So usually most therapists will offer, I know I offer a free consultation to all my patients. So that way I can kind of gauge if they really need my services.
Mm-hmm.
When they do come in, we go through everything. So I want to know your medical history. I want to know about if you've had pregnancies, how many deliveries. If you don't have children, that's fine. I want to know bowel and bladder habits. I'm going to assess a woman's pelvic alignment. I'm going to take a look at, her posture. How is she breathing? Her muscles. Are there weakness? Is there tension? How is her range of motion?
Mm-hmm.
Are her ankles tight? Could her hips be tight? Could that be where the muscles are kind of pulling from?
Mm-hmm.
And then, of course, once I kind of get that information, I always take a look at their actual pelvic floor. So when you think about your pelvic floor, it's like, think about like a trampoline almost, right? So it's going to insert in your pubic bone and then go all the way to the coccyx bone. Mm-hmm. But it also attaches to your two hips.
Okay.
Right? So it's kind of like a bowl, if you think about it that way. So for me to assess a woman's pelvic floor, I would do an external and internal exam with them. And of course, it's always to consent. It's a lot different than a GYN. So I would always walk them through every step. We do use sheets to cover, so you're not fully exposed the whole time, because we do respect and understand privacy and modesty. And it's always what the client is comfortable to do. So if a woman comes in and she's like, you know what, I'm not comfortable to do internal work right now, that's fine with me. We could always do that at a future visit. I mean, ideally, we would like to do it the first visit, but we always do what's comfortable for the client first.
Yeah. Yeah. So I can only imagine, one, it being scary to having this diagnosis or thinking that you will have this diagnosis. And then just the procedure of going through it can be a little bit scary too. So it's almost it sounds like very important to find somebody you trust and that you resonate with, and that you have a good relationship with, that will not make you more anxious, which is causing, might be contributing to your pain, right?
So I actually have training in cognitive behavioral therapy. So with all my clients, we talk about everything and I help them to work through things. So for me, it's not just only the pelvic floor. So if the client is having trauma related anxiety, right? Then maybe doing internal work right off the bat is not appropriate. And maybe we backtrack and kind of do things more externally until that patient has trust.
Yeah.
Rapport is always important, and understanding. So the first session is always kind of explaining like what exactly, because think about it, like no one talks about this. So you don't know what your pelvic floor does. So I do bring out like a model. I explain to them like exactly what their muscles do. I try to help them understand like what's going on in the body. I do help to bring awareness to like, are you clenching? Are you holding your breath? Is your breath supporting your pelvic floor? And helping them to become like more in tune with their body and understand like, okay, so my breath is not supporting my pelvic floor, but now I understand why, so I can fix it.
I love that.
Yeah, it's so amazing that it's not just a musculoskeletal disorder. There's breath work involved. There's trauma behaviorals involved. There's constipation. There's anxiety. I mean, there's so many things that we all deal with on a day-to-day life, and the stuff is not known that it's contributing to these other factors that, an autoimmune disease, but pelvic health issues and so many other issues that could be involved. I'm assuming.
Right. It's definitely a holistic approach.
And I love that you
really
take it like that. Yeah.
Yeah.
You were mentioning too earlier, it's not just you who helps with this work. You also refer out to some other professionals that you think could help complement what you're doing. Could you go into that a little bit too?
Sure. So I do often refer patients to acupuncturists, especially if they are dealing with any kind of pain, sensory issues. I will refer them to an acupuncturist. If they are having like spinal issues, maybe neck stiffness, mid back stiffness, or even if I notice that like on, turning and breath training, there may be restrictions in their upper spine, I will refer them out to a chiropractor. There's been many times where I have had patients come in with plantar fasciitis, which is very painful and often really makes the pelvic floor work harder because the person is avoiding weight on the ball of the foot and everything is kind of on the heels. So I will definitely refer a patient to see a physical therapist. I definitely work with practitioners in my community. I mean, the goal is just to get the person well and happy.
Yeah.
And back to living life.
That's all our goals, right? That's all we want for our patients and ourselves. And it's incredible. Jessica, do you have any other questions for Nicole before we wrap up?
I don't, other than Nicole, I obviously from how you've described the therapy, this is an in-person type therapy. So where can people find you? And like, what is the area that you work in? I know you mentioned that you are in New York, right?
Yes. So my office is located in Rockland County in Stony Point, New York. And I also do mobile care for Bergen County, New Jersey. But I do offer virtual visits, and only if it's applicable. So for example, if the person is going to require more manual, then no. But if it's more, appropriate to do virtual, then yes, I will often do virtual.
Wonderful.
Awesome.
And what is the best way for people to contact you if they would like to work with you?
Sure. So I definitely will respond to any phone calls. They can go to my website, which is www.pivotalot.com. So pivotalot.com. I respond to emails pretty quickly. I'm on Facebook and I'm also on Instagram, and I will answer DMs for people as well.
Perfect.
Wonderful.
We'll get all that information from you, Nicole, and we'll put that in the comments and when we post this video, so they can get a hold of you if they are in the county or thinking about doing virtual. I know I learned a lot from this discussion as well. So thank you so much for being a part of this talk and sharing your knowledge with us. And I love all the passion you have about this. It's incredible. So we appreciate you.
Yes,
Thank you
so much.
so much. Thank you.
Definitely. All right, everybody, we will be back next Wednesday, not Tuesday. And until then, if you have any comments, please put them below. We will post Nicole's
Contact info.
thank you, brain fog, and we will be back next week. Everybody have a good weekend.
Take care.
Bye, guys.